Hello, Dr. Saswat Soumya. Congrats. We are very proud to have you here, and thank you for attending here and taking this interview. We feel very thankful that you've joined us here. It is a great feeling to come out and achieve your dream and your goal. So, how are you feeling at this moment?
Namaste, sir. Thank you very much, sir. I feel extremely glad. And to be true, sir, for me, this is a great opportunity to get a chance to interact with you.
We are always there for you. So anytime you can just pick your phone and you can talk to me. I'm sure all the videos are actually displaying my number also, right? So please feel free
Yes,
to
sir.
get
I
it.
have been.
Good, good, good. So tell us a little about your journey, how it all started, and what was your initial days, how you got interested in oncology.
Sir, I am from Puri, Odisha. I have done my MBBS and MS both from SCB Medical College, Kotak, in Odisha only. And my MS was completed in February this year. And I have been working as a senior resident for a brief span of time. And then I took break for dedicated preparation for this exam. And sir, during my residency, I had fair exposure to surgical onco cases. And in our college, for the peripheral posting, I also had exposure to onco cases since we have Acharya Hariyar Postgraduate Cancer Institute close to our center.
You were at Acharya Hariyar before, so you'd have had a great
Yes,
exposure. Okay,
yes, sir.
please go ahead. Please go ahead.
And sir, during the posting, I developed fascination and the preoperative planning and surgical dissection. These things always made me more curious for the subject. And sir, the multimodality approach for patients and recent trend of individual approach for cancer management. These things always fascinated me to go for this rising branch.
That is great. Just like the Puri Jagannath, you are also unstoppable. You have gotten through, and you have been Juggernaut. Just passing this year, and after your residency, you have gotten in almost immediately, and that's a great feeling. You must be feeling good about it. So, congrats, you have done. So, which aims do you want to opt for? I think you almost everything will be available. So,
Sir, I am considering to stay in Odisha. Most probably, I
oh,
am going to opt for AIMS Bhubaneswar.
oh, great, great, great. Bhubaneswar is a great place. I've been there, and a couple of my other colleagues junior colleagues have also joined there. So it's a great place. It's got great exposure. Almost all fields are available there. It's one of the better aims that you have. I mean, almost all aims will have a good exposure, but especially Bhubaneswar is among the top aims that we have. After Delhi, I think probably Delhi is the first choice for many people. After that, many people
So,
choose either Bhubaneswar or Jodhpur. So, congrats. So, you've gotten it. I mean, all through doing it all in one single state itself is an achievement. That's not easy for many people.
yes.
You managed to do that. So tell us how at DocTutorials we were able to help you either in terms of the videos or in terms of QBank tests. What all did you apply for? How did you prepare?
Yes, sir. I have been a old student of yours, sir. During my residency only, I had a subscription for this app. And sir, from second year onwards, I started watching videos. Uh, and sir, those videos were very much comprehensive. And this comprehensive video helped me understand complex concepts. And sir, it helped me apply it also in MCQ to solve it properly without getting confused. And sir, the notes, I also had ready-made notes of the same app. And I also added some MCQ points, and GTs were also very much helpful. I dedicatedly appeared almost all GTs that were available for surgical oncology. Um, and sir, I also followed the ISO webinars that are available in YouTube that helped me to understand the approach, and the panel discussion helped me understand it in a very good way.
So dedication is the key. I can see that you have been doing it on a regular basis. So I can tell that from you what the junior colleagues and other your friends need to learn from is basically to stay consistent, keep doing things on a regular basis. That is what will help you get through the exams.
Yes, revising the same notes in on layers, different concepts, sir. In fast go, the understanding gets clearer with subsequent revision. That helped me solving difficult MCQs.
That is good. And one very important thing that you mentioned, is to understand the key ideas behind everything. That is what helps you solve MCQs, because not every time the MCQs come directly as it is from the previous question papers or things like that. So that is why we at DocTutorials, almost all faculties, I think we try to teach you what is the idea behind or the understanding behind each thing that is there, and that helps you move forward in a great way.
Yes, sir. More importantly, sir, the recall videos of yours that are available, uh, the discussion and the subsequent possible future MCQs and these concepts were thoroughly discussed, sir. That helped me concise possible corners concepts that are helpful for upcoming exams. That was very much helpful.
Yeah, as I always say in the recall videos, it is not the same question that will come, it will be the same area questions that will come, and that generally helps you crack. And that is why I try to add on a few extra points and not just give the answer alone. So I think
Yes,
you
sir.
have managed to crack it and you have managed to do it, and
Yes.
great work. So, uh, tell us a little bit about your family and how you want to go ahead and thank anybody who have been helpful in your journey.
Yes, sir. My family has been always helpful and they supported me throughout my journey, starting from my UG. Sir, my parents and my in-laws, they supported me through the phase. And my sister and brother-in-laws, they are also very much supportive. And in fact, sir, my wife, she supported me in every decision I made. And when I was having self doubts, she was the one, she always reminded me of my potential to do my best. And sir,
That
definitely my seniors and friends, they have been a constant source of support. And sir, I must say, with the blessing of Almighty Lord Jagannath, He has been watching over me through this difficult phase of preparation. And sir, I must convey my gratitude to you and the doctoral teams for curating such high-yield concepts and imbibing us with the subject and for the encouragement and guidance.
Thank you for your support. We just wish that all students get benefited and achieve their dream, basically. So, it's like everyone has a dream. Mine was to take up surgical oncology when I was doing my MS. In my second year, I decided I wanted to do oncology, either onco or gastro. Those two are my top field. And compared to what many people had at that time, I chose oncology as my first choice, and second choice was gastro. So, I think everyone has their own passion, and that is what
Yes,
will
sir.
drive you. A field, any surgical
Yes,
field is not easy. It has got its own share of challenges, and getting in into any field is going to be difficult. And you have done that. You have cracked that. You have achieved your dream almost immediately after finishing your residency, and I'm sure you'll go great places, Dr. Shashwat. So congrats once more, and all the best. Please feel free to use the app. You are getting some new updates also based on the latest guidelines and this one as well.
yes, sir.
I talk to the team and I'll be able to help out with that. Usually for all our rankers, we help them out by carrying on the subscription of the app. So that I think we can arrange for you definitely. So you may
Thank
use
you
it
so
during
much.
the period as well, period of your super specialty training as well. That will help you go ahead with and reap benefits, because I believe some of them use it even during the super specialty period for
Yes,
helping
sir.
out with exams and all. So
Yes.
congrats to you once more, and thank you for joining us. Any words of encouragement for your colleagues who have not been able to make it, and for your friends who are trying? What would you tell them, either about planning and working, and about doctor tutorials or anything in general?
Sir, I believe the contents in Dr. Tutorial are highly comprehensive that can be easily revisable, and the MCQs are highly curated that will supplement the videos. And sir, the INI recall videos, that is a most true thing. And sir, finally, I think self-belief and discipline is the uh, key to achieve uh, to this tough entrance exam.
Absolutely, you hit the nail in the head because just as I named initially, consistency is the key, and you have to be consistent, do it on a regular basis. That if you do, and as you mentioned, taking some time off at the end, preparing, the whole day, working and putting in the effort. It's like giving the final push for the sprint in a marathon. The last 100 meters, people run literally hard, so that push is very
Yes.
important. And self belief. I always keep telling all of my junior colleagues who join me, see, we are all just the ladders who help you. We help you, just show the path basically, and only you have to walk the path. And that I believe many of you are doing with great effort and with, you know in a very very good fashion. So congrats once more, Dr. Shashwat, and please feel free to interact at any point of time. As always, I'm available on WhatsApp. Calls maybe sometimes may get missed, but definitely on WhatsApp I'll be there, and you can always get in touch. Please feel free and have a, nice time. Enjoy your time a little bit. Have a Merry Christmas and a Happy New Year. Enjoy your time a little bit before you take on the next phase in your life and your career. All the
Happy New
best.
Year to you, sir. Thank you, sir. No.